A patient came to me with bleeding from the rectum. This happened very recently. We checked everything and found that there was a large ulcer in the rectum. Ulcer means don't think cancer. This is not cancerous, but this is just a large area where the lining is lost. We have a unique test called MR proctodefecogram. That means we actually make the patient sit on the MR table and pass motion. Motion means we will empty everything and put some dye and make them pass the dye. It's fascinating that when you take a dynamic MRI means as the patient is passing motion, you can see which muscle is getting elongated, which muscle is hanging. So much of data available which was not available a few years ago. We found out this patient has something called rectal intussusception. The rectum intussuscepts or telescopes into itself because of the extra length. We landed up operating and removing the extra length of colon, cutting and joining and fixing it all laparoscopic through 3 small holes so that the patient was walking around by the same evening and went home in 3 days' time, and the patient is completely cured of her symptoms. And this is one of several cases that we have done. This condition is called Solitary Rectal Ulcer Syndrome, and unless you do a sigmoidoscopy and a dynamic MRI, you will not find out the reason for this. So new diseases are coming up, new diagnostic tests are coming up, and when a surgeon writes, go and do this CT scan, do this MRI, there's a reason for this. We will often find out the small print diseases and make you alright. This is Dr. Rajkumar from Lifeline Hospitals, wishing you the best of health. Jai Hind.